Good morning, Professor. My name is Daniel Chancellor. I'm a FNP student in MSN 572, and this is my video prior to head to toe musculoskeletal integrity check. And my volunteer patient. All right. All right, my name is Daniel, and I'm an FNP student at USU. And before we continue, I'll ask for permission if we can continue to record, and then I'll post this on YouTube as Unlisted, and copy the link and send it to my instructor so they could evaluate my assessment skills for a musculoskeletal video. Do I get permission?
Yes.
All right, so the real clinical world, you introduce yourself, I explain what you're going to do. You wash your hands and ensure a patient is comfortable, and explain your procedure prior to doing it. So that being said, we begin with the hands. I'm going to inspect the hands. I'm looking for to see if there's any nodules, deformities, erythema, edema, any trauma, any scars, and you're also looking at the color per ethnicity. And then we're going to palpate distal and proximal joints for any tenderness or any pain, and patient will let you know if they're exhibiting any pain. And then we're going to run the hands into some range of motion. The first one is we spread our fingers apart, and that's abduction, and then we're close them back together, that's adduction, and then the hands can also extend and flex. And then we go ahead and assess the wrists. You're looking at the owner wrist and see if there's any deformities or any inflammation or any trauma. And you're also looking at the symmetry of them in relation to the hand and the joints. After that, we're going to run into some range of motion with the wrists, which will be similar to the hands, so they can also flex and extend, and then they can abduct away from the body and adduct towards the body. And from there, we go ahead and look at the elbow on both sides. You're assessing to see if there's any bumps, any edema, looking for any color changes or any trauma. And then you're going to go ahead and palpate lateral and medial epicondyle and the lacrimal point process that's behind the elbow, if there's any trauma or any swelling, and you do that on both sides. And then we're going to run the elbow into some range of motion. And then you just pronate, that's your hands like this, and then supination is up. And we're going to move to the shoulders now, and you're looking at the symmetry of the shoulder and the head and the alignment of the shoulders, and then you go ahead and see if there's any injuries to the shoulder. If those are dislocation, you're going to have one side drop or you'll be hanging, and the other, it's not going to be symmetric, it'll be disaligned. So you go ahead and palpate, beginning with the sternum notch, and then you go across on the clavicular points until you get to the acromion process, and then you go ahead and palpate the pectora and the medial part of the deltoid. And there should be a coracoid process there, and the greater and lesser tubercle points here, and there shouldn't be any tenderness. If there's any tenderness, that's indicative of either a librium tear or a rotator cuff. And we're going to run the shoulder into some range of motions. First, you can extend, and then, flex, and then extension is in the back. and then we do that bilateral extension. Okay, and then abduct is outside, and then adduction is across the shoulder. So this right here is also called the cross arm sign, which you can use if there's if patients complain of tenderness in the shoulder. That can be indicative. If they do the cross arm test, this can be indicative of a rotator cuff tear. Okay, and so other range of motion with the shoulder. We have patient put the hands to the side and make a fist, and then if I try to pull these down and patient presents pain in here, that's also indicative of having a rotator cuff or labrum tear. Okay, and we're going to do another test. You have patient the apprehension test. This is so you kind of present like a baseball throw, or like this. Okay, and then I put my hand on his scapula and kind of raise it. And if he presents pain in here, that's also another sign for having rotator cuff problem. That's and then we have the speech test and the latent test. So patient in the arm drop. So in the arm drop, I'm going to ask patient to go ahead and raise the arm to 180, and then bring it down slowly all the way down. And if they exhibit pain in any of this movement, that's another indicative sign of patient having shoulder, labrum, or rotator cuff problem. And then we have a Hawkins test. The Hawkins test, you're going to flex and then bring your arm up to right here. And I'm going to put my hand under and try to raise this, and if patient is having pain through here, that's another sign of indicative rotator cuff. And the same thing here, flex, I'll be standing in the back. So kind of raise the arm up, and then if that brings pain in the shoulder, that's indicative of having a rotator cuff or labrum tear. And to our hands, we have a couple of special tests that we do on the hands. The first one is the Finkelstein test. In the Finkelstein test, patient is going to have hands down like this, and then going to put pressure. And if there's any pain, this is for carpal tunnel. If there's any pain while putting pressure, that's indicative of having carpal tunnel. Okay, and then we have the Pheno test. That's the prayer one. You could either go like this or like this, and you press for 30 seconds. And if there's any pain going down, that's indicative of carpal tunnel. We have the medium compress sign, and this one we also put pressure for 30 seconds in here, and if it's having pain in the distal end, that's indicative of carpal tunnel. The Allen's test is another test that you do. This one is done prior to collecting arterial blood gases. So you have patient make a fist, and then I'm going to occlude both arteries, the ulnar and radial arteries, and then relax, and then let go, and it should pink up right away. And then you do it again, and then relax, and I let go, and it should pink up again because you're occluding. So it's checking for vascular flow, and you do it bilateral. Okay, now we move to the cervical spine. So I'm looking to see the alignment of the cervical spine, beginning with the C7 and going all the way to the lumbar region. So we should have a concave from the cervical, and then on the thoracic it should be convex, and then on the lumbar it should be convexity as well. And then you palpate beginning at the C7 to see if there's any displacement of the spinal vertebrae. or any tenderness, and the patient should be able to verbalize to you if there's any deformities or anything of that nature. And we run the spine into some range of motion, so you're going to see if you can touch your toes. Okay, and that's flexion and try to stand up, and try to lean back. That's extension. Okay, and then for the cervical neck, the lateral turns. See if you can look to the left. Turn your head to the left, and then turn your head to the right. Those are lateral movement of the cervical spine. And then flexion is chin to chest. And then look in the ceiling for extension. Okay, and then see if you could do a circle around the world with your head, and that covers the rest of the range of motions in the cervical neck. Okay, now we move to the hip. Go ahead and lay on the examining table. Okay, so we'll begin by assessing the hip. Is it symmetrical to his body? Is one higher than the other? And then we'll begin with flexion of the hip. Lift your leg up in the air. Okay, back down. And then to do the extension, would lay prone position. And then the leg up in the air. That's extension. That's extension, all right. Go ahead and sit. All right, we have a couple of special tests that you do for checking the abduction of the foot. Okay, let's flex the knee. All right, so I'll place one hand here. We have the volus and vogus test, and basically what it is I'll try to push out, and then you switch. You push back in, and if there's any pain in that region, that could be indicative of some kind of meniscus tear or ACL injury. And you do that on this leg too as well. You have the palm of my hand on the inside and push out, and then pushed out or push in. Push out and push in. Okay, and then we'll do adduction and abduction of the knee. So if you lay down and you flex your knee. Okay, so abduction of the knee now is just basically coming out, and adduction is going back in. All right, and let's try the other one. The same thing. Abduction outside, adduction inside. All right, and then rotation of the hip, internal rotation. We'll bend, kind of flex the knee a little bit, and then you do a circular motion, and then you extend, and there shouldn't be any pain while doing that. And then you do the same thing on this side. All right. Then on the knee again, if there's any detection of fluid, there's a couple tests you can do. The balloon or the ballpoint, and basically you kind of start from outside and you kind of working your way inside to see if there's any fluid shift in the knee, and then you put pressure on the patella, and then you let go, and the patella should be a midline. And then you could also push the patella on the side and have patient flex your knee, and then it should go back to where it belongs after being displaced on the first time. And if the knee does not allow the patella to go back, that's indicative of having some fluid in the synovial joints. We move to the last part, which is your ankles, and you inspect the foot itself. You're looking at the callus of the foot. You're looking to see there's no trauma, any deformities, or any nodules. And then you palpate the metacarpals of the feet. Make sure there's no tenderness or pain. And then the lateral malleolus, that's the outside of the sticky bone. And then the medial malleolus, that's the inside the bone sticking out. And then the range of motion in the foot, basically, you could do like a circle with your foot, and that covers all the range of motions. And to check the strength of the foot, okay, I'm going to push this way, and you go against me, and then push against me. And that's how you check for strength. Push against me, and then push down, and that's your strength. And the Achilles tendon, that's what enables us to stand and walk. Without the Achilles being there, you have no chance of walking around. All right, that's the musculoskeletal exam from head to toe. Thank you for your time. Appreciate it.